Okay, here we go. What should be the final read for the last part of What Every Girl Should Know, number 14 in the Little Blue Book series, written by Margaret H. Sanger. And we left off on page 50 at the top of the page, and we shall turn back and start. Okay, at the end of the period, the child and the placenta are expelled from the uterus. The uterus gradually restores to its former size. It requires about 6 weeks for this to occur, and it is very important that there should be no heavy lifting and overwork at this time. As a rule, after childbirth, the woman's form becomes matured and more developed. The facial expression takes on a kinder, a maternal look. The whole nervous system is awakened. Nose is itchy. The whole nervous system is awakened to sympathy, pain or grief, bringing tears to the eyes quicker than ever before. Especially is this true for the first few years following. The important thing is that the care of the pregnant woman should be begun in girlhood. If we are going to be and have mothers, then we should give attention to the development of the organs that make mothers. Number 6, Some Consequences of Ignorance and Silence, Part 1. When the boy arrives at the age of puberty, he is in greater danger than a girl of being not only led astray by companions, but being actually sent into unclean living by those nearest to him, the most interested in his welfare, his parents. The reason for this is that there has been and still is a false notion among many parents that so soon as the boy has seminal emissions he must have sexual relations or suffer in health. That the seminal emissions are not harmful and that they grow less frequent as the boy grows older is a fact of which few mothers seem to be aware. One of the most common errors I have found among people, even those educated in other lines of thought, is that the sexual organs will become useless unless they are used in early manhood. This is considered untrue by the best authorities on the subject, for it is known that the essential organs of reproduction are glands, not unlike the tear glands in the eyes or the milk glands of the breast. The tear glands do not atrophy even if one does not cry for years, nor the milk glands during the entire period of reproduction. The same can be said of the sexual glands. Another idea which is fast being uprooted is the idea of the sexual act is an appropriate Another idea which is fast being uprooted is that the sexual act is an appetite, not unlike that of hunger and thirst, which must be fed by the boy's sowing his wild oats before settling down to marriage. It is now a recognized fact that it is no more necessary for a boy to sow wild oats than it is for a girl and woman and woman are today demanding of men the same cleanliness of body and mind which men have heretofore considered necessary only in women. It is now the unreserved opinion of the foremost medical men of the day that a man does not suffer in health from living a continent life, nor is he a mollycoddle from so doing. Just one more word on the subject of continence, and that is that it is not at all unusual to find men determined to remain continent until they find their ideal woman. Nor for athletes in training engaged in contests, nor for sailors on long sea voyages, and many others for long periods of time, is continence impossible. In fact, they are better for it. Some consequences of ignorance and silence, Part 2. The two venereal diseases which I will tell you something of here are the most commonly known to all, gonorrhea and syphilis. Gonorrhea is an inflammation of the urethra, water passage, characterized by redness, swelling, smarting pain on the passing of water, and accompanied by thick, purulent, poisonous discharge. At first creamy in color and later a greenish yellow, it is considered by the highest authorities as solely a sexual disease in adults, depending almost exclusively upon sexual intercourse as its mode of origin and infection. Children, however, especially infants and little girls, can be infected by the hands of the mother or nurse being soiled with the discharge. Also, where the fresh discharge is on towels, toilets, etc. It starts an inflammation of the outer delicate parts, but seldom enters the urethra. In former days, gonorrhea was considered an ordinary catarrhal inflammation, no worse than a bad cold. The old saying went, it was thought to originate in women with the discharge at the end of the menstrual period, or leukorrhea. In fact, any secretions from the uterus of an irritating character were thought to be sources of gonorrhea. However, with the discovery of the microbe gonococcus in 1879 by Dr. Neisser, it is now an established fact that the disease comes from a source where there is either latent or chronic gonorrhea, which of course means that the gonococcus is present. It is considered a conservative estimate that at least 50% of the adult population in the country have suffered from gonococca infection. More men than women have been and are infected. The first symptoms of the disease appear from 3 to 7 days after infection, and under proper treatment, the discharge may disappear in 6 or 8 weeks. If the man or woman places himself under the care of a specialist within 48 hours after infection, the disease is often of much shorter duration. When allowed to become chronic, it is called GLEAT. Too much emphasis cannot be put upon the danger of placing anyone with the disease into the hands of the doctors who advertise so conspicuously, claiming rapid and complete cures for all sexual diseases. Experience has shown that thousands of boys and young men attracted by such alluring promises as only the quack can put forth have been under such treatment, only to find later that the disease was allowed to remain in the tissues, the discharge only having been dried up. The germs were allowed to continue their work on up into the bladder, kidneys, joints, heart, and even to the brain. The germs can live for years in the body, hidden away in the gland ducts, the mucous membrane of the organ first attacked being in a normal state, yet when a condition arises in which the vitality of the tissues in which the germs are lodged is lowered, or which gives the germs themselves more nourishment or stimulus, such as alcohol or excessive intercourse, they almost always become active again. In women, the small part of the womb, cervix, as well as the urethra, are favorite places of attack. When the disease attacks the cervix, a woman may not be conscious of it, and so, unless prominent symptoms attend it, she may infect many persons in the meantime. In man, on the other hand, the disease cannot be present without his knowing there is something wrong, and it should be impressed upon him that it is a moral obligation on his part not to have sexual relations until he has been examined and pronounced cured by a specialist in genitourinary diseases. Your general practitioner will always recommend you to a specialist if you ask him to. When the disease attacks the uterus and ovaries, it very often blocks the fallopian tubes and presents the impregnation of the ovum. It is said that over 1/3 of the childless miscarriages are due to gonorrhea in women, innocently contracted from their husbands. Both men and women can become sterile from this disease. The seminal tubes in the man become blocked, thus disabling him from impregnating the ovum. Gonorrhea differs from syphilis, and though it is not a disease which can be transmitted from the parent to children, as syphilis can, yet it is a subtle wrecking disease and can do almost as much harm to the individual. Syphilis is an infectious disease caused by a special microbe which is caught by contagion or heredity. It is chronic in course, varied and intermittent in character, and the length of time it remains in the body is indefinite. It is so widespread that no country in the world is free from it. Neither is any organ of the body exempt from its ravages. Let us take a young man indulging in promiscuous sexual intercourse who cohabits with a syphilitic woman. He notices nothing wrong for about 5 weeks, when he becomes aware of a pimple on the sexual organs, to which perhaps he pays little attention. This grows and becomes hard at the base and is ulcerated on the top. About 10 days after the appearance of the ulcer or change, the boy neglects that the glands of the groins begin to swell, but as there is little or no pain attached, he still pays no attention to all this. After 3 or sometimes 4 weeks, the ulcerated opening heals but leaves the hard lump under the skin. In 2 or even 3 months after the time of infection, the first general symptoms appear. His bones ache. He is mentally depressed, slightly feverish at night, and a rash appears upon his body, and sore spots in the mouth and throat. These symptoms usually decide him to consult a doctor, who finds him in the second stage of syphilis. This condition lasts usually about 2 1/2 years, the rash often lasting a short period, and leaving but to return again. The blood within the ulcers on the body contain the poisons of the disease, and for 3 to 4 years the poison can be transmitted by contagion or by heredity. The third stage is the most destructive, especially to the nervous system, for this disease is recognized as the greatest factor in organic disturbances of the nervous system. It not rarely is the cause of cerebral and spinal meningitis, paralysis of the legs, paralysis of one side of the body, and the most helpless and terrible disease, softening of the brain, and many other diseases which affect the spinal cord, which are seldom if ever cured. The majority of those diseased are left with physical or mental infirmities, rendering them public charges. There have been cases where the third stage did not develop, and as the stage is not distinctly separated from the second stage by a definite line, it may not take place for months or even years after the first sore appeared. Again, this stage has been averted by careful treatment in the early stages, and it is here that the hope of all the affected lies. Every case of syphilis begins with a characteristic pimple or chancery, except inherited syphilis. The chancery always appears where the infection enters, and the glands swell in the same vicinity. For instance, if he uses the pipe of a syphilitic whose mouth contains the sore patches, the victim finds the chancery will appear on his lips, mouth, or throat, and the glands of the neck will swell. It is said that almost 10% of the infections are contracted innocently, especially in European countries, where kissing and other forms of endearment are much indulged in. In this country, innocent infection is not so common, but more women than men contracted innocently and in this manner. In women, too, the first symptoms are not so characteristic as in men. She may pay no attention to the chancery for a month, even if she does feel aches in the bones. She thinks she is run down, or thinks she has malaria. Even the rash does not alarm her, and often only repeated miscarriages will be the only symptoms she can remember of the early stage. She may continue for years before the disease reaches the third stage. This is not always so, for in every individual the disease differs in character and duration. Gonorrhea and syphilis differ in many ways. For instance, the former shows itself in a week or 10 days after infection, where syphilis shows no sign for 5 or 6 weeks. Gonorrhea is considered a purely sexual disease because infection takes place only in sexual relations, except where the germ gets into the eyes, while syphilis can be contracted in many other ways, through forks, spoons, glasses or cups, towels, sponges, bathtubs, toilets, pipes, dental and barber's instruments, and kissing. Gonorrhea is considered a social danger because it has direct effect upon the offspring and upon future generations because its effects are visited upon the child. The cure of syphilis depends upon the individual's environment, constitution, and his habits. Chiefly as regards alcohol and tobacco, alcohol is considered the commonest and most active enemy of the patient's recovery. Men addicted to the use of alcohol are the most difficult to cure. There seems to be no doubt that if the disease receives the proper treatment, there is every hope for the individual to live a normal life. Further information about these and other sexual diseases is available in Dr. Greer's Venereal Diseases Little Blue Book number 726 and in Dr. Pusey's Specialized Syphilis Little Blue Book number 903. Pardon me. Chapter 7, Menopause or Change of Life. In the chapter of puberty, it was stated that the menstrual function began in the average girl at 15 years of age and continued until the 45th or 50th year. At this later age, it ceases, together with her sexual or childbearing capabilities, and is known as the menopause or change of life. This constitutes a period from the beginning of irregularities in the appearance of the menstrual flow until it has actually ceased, which period usually lasts 2½ to 3 years. Thousands of women know nothing of the period which, like puberty, they must pass through, being entirely ignorant of the process. It is usual for them to look toward this age with dread and foreboding, where a little knowledge of the nature of the process would enable them to enter upon this period physically prepared, ensuring their safe passage through this dreaded and much feared period. The greatest change occurring in the woman at this time is that which goes on in the ovaries. They cease to do their work, and ovulation stops. The first indication of the woman this is likely to occur is by the ceasing of the menses or monthlies. Menstruation. Ovulation, however, very often continues for several months. Even a year after menstruation has entirely ceased. The glandular tissues of the uterus, tubes, and ovaries degenerate, which is said to account for the menopause, and that of the ovaries occurs later than the tubes and uterus, which explains the continuation of ovulation after the menses have stopped. In a few women, the menopause is accompanied by very little or almost no discomfort at all. Just the sudden stopping of the monthlies announces to them that this period has come. The majority, however, do not pass through this time so easily, but suffer for the entire period with one affliction or another. Among the symptoms most common are flushing or flashes, which are mostly confined to head, face, and neck, and are increased by heat and motion, and are followed by profuse sweating, giddiness, backache, sleeplessness, disturbances of digestion like diarrhea or constipation, blueness, depression of spirits, shortness of breath, palpitation, and nervous irritability. But the most alarming symptom of the menopause is hemorrhage. This is too often considered lightly and classed with the minor symptoms of the period. Whenever there is excessive bleeding, there is surely a cause which calls for special and immediate attention. There may be an inflamed condition of the lining of the uterus, the womb, or ulceration. General diseases of the heart, lungs, and kidneys can also be the cause of excessive bleeding of this period. Some authorities claim that it also has its cause in early or profuse menstruation, too frequent and difficult labors, abortions, and alcoholic drinking. But the most common cause of hemorrhage at this time is cancer. It is a fact that cancer in women from the age of 40 to 50 is more common than at any other stage. Perhaps it is not generally known that cancer sometimes begins as a local disease and if taken in time can be removed so completely that radical cure follows. No wonder, then, that hemorrhage should be an alarming symptom, for if care is not taken, the dreaded disease cancer may be allowed to take root, and that the results are too generally known to dwell upon. At the first signs of hemorrhage or excessive flow, a woman should place herself under the care of a gynecologist, specialist in the disease of women, just as a pregnant woman is under the care of a physician until she is entirely free from the dangers of childbirth. Women have heretofore looked to this period with dread on account of the consequences which neglect has caused. It need not be dreaded, for assuring word comes from prominent physicians who have made this special period a study, that the natural symptoms of the menopause do not portend loss of life, reason, or health. It is a period as natural to the woman as menstruation, and with a little care these symptoms or ailments will cease in a few years, leaving the woman to enjoy many more years of good health. When the period is delayed beyond the 50th year, it calls for the same attention as excessive flow. These are two important signs of disease and should receive immediate care. The period is, however, often brought about at an earlier age than is normal by mental or physical shock, illness, operations, etc. The age at which it occurs often differs with climate, race, and social relations, for one authority claims that the sexual function is generally abolished earlier in the laboring classes, who are compelled to work hard and have many cares, and further states that a vigorous vitality causes prolongation of the menstrual process. In the average woman, it does not cease at once, but has 2 or 3 periods of cessation, returns again for an irregular period, and continues in irregularity for the entire time of 2 1/2 to 3 years. It is important to know that the changes which are going on in the organs of the woman are exactly opposite from those which occur at puberty. At puberty, the organs are increasing with life, vigor, and vitality, while at the menopause they are receding or going backward. The generative organs generally but surely shrink or atrophy after menstruation stops. The uterus becomes small. The vagina, whose walls were formerly corrugated or wrinkled, now becomes smooth. The orifice or opening of the vagina becomes shrunken unless it has been previously enlarged by childbearing. The whole process tends to show that the childbearing period at the end is at end, which in fact has caused much mental anxiety and disturbance among women to the extent of melancholy and insanity. It seems a very small thing to give to every woman going through this disagreeable period of life a complete change of climate and rest, until the change has become established. Certainly she has served society to the best of her knowledge, often entering into the valley of the shadow of death many times fearlessly, to give the best of herself to the race. It is a small thing to give in return. All that is needed is to keep guard on oneself. Watch the diet and bowels. A light vegetable diet seems best at this time unless very actively engaged in physical exercise. Eat meat once a day. Keep free from foods difficult to digest. Cheese, fried foods, hot something, etc. Drink plenty of water and eat fruit to keep the bowels open. Slight exercise in the open air, rest, sleep, and freedom from mental anxiety are the simple rules which are generally prescribed for women at this stage of their lives. Chapter 8. Conclusion. In completing this discussion, I cannot refrain from uttering just a word about the relation of the entire subject I have been discussing to the economic problem. It is impossible to separate the ignorance of parents, prostitution, venereal diseases, or the silence of the medical profession from the great economic question that the world is facing today. It is here ever before us, and the more we look into the so-called evils of the day, the more we realize that the whole structure of present-day society is built upon a rotten and decaying foundation. Until the evils of capitalism are swept away, there is no hope for young working girls to live a beautiful life during their girlhood. There is no hope for boys or girls of the laboring classes to build up strong and sturdy bodies. There is no hope that a woman can live in the family relation and have children without sacrificing every vestige of individual development. There is no hope that prostitution will cease as long as there is hunger. There is no hope for a strong race as long as venereal diseases exist, and they will exist until women rise in one big sisterhood to fight this capitalist society which compels a woman to serve as a sex implement for men's use. Note: the attention of the reader is called to the Little Blue Books by William J. Fielding, which extend the discussion of this same subject, amplifying and emphasizing its various phases. What every young woman should know, number 655. What every married woman should know, number 657. Women's sexual life, number 639. What the women past 40 should know, number 536. And to Dr. Charles B. Reed's What Every Expectant Mother Should Know, number 127. Readers desiring to communicate directly with Miss Sanger may address her at the American Birth Control Leagues Incorporated, 104 Fifth Avenue, New York City. And this concludes the reading of What Every Woman Should Know, book number 14 of the Little Blue Book series, written by Margaret H. Sanger. See you next time with a new book from the library.